We're now joined by Dr. Sameer Gupta, cardiologist of the Metro Group of Hospitals, and also someone who's a COVID survivor himself, and also Dr. Rajesh Parekh, Director Medical Research, Just Lok Hospital, someone who also wrote a book, co-authored it, Coronavirus, What You Need to Know About the Global Pandemic. So first to you, Dr. Parekh, very worrying figures coming out. What is your view of the situation in the country right now with over 83,000 cases being reported? We're about to overtake Brazil.
Yes, Gargi, if you'll just pardon me for being repetitive, because I was on your show the other day and I may wind up repeating some of what I said that day. That first of all, these 83,000 cases that we are seeing daily are confirmed cases. The confirmed cases are those of people who have been tested and found to be positive. So they are contingent on our testing rates, which, while being better than what they were earlier, are still far, far short of what we really need to do. In perspective, Brazil is doing twice as much testing as we are, and the United States is doing 8 times as much testing as we are per million in the population. That's one number we need to look at. Having said that, in our book that you alluded to, we had, as way back as in March, while emphasizing the need for testing, made a prediction that our country would very soon probably have the highest number of unconfirmed cases in the world, and that as testing got ramped up, the number of cases perhaps would, confirmed cases I might say, would be the largest number in the world. So yes, I mean, this is a worrying trend, but we need to stay focused. It doesn't help us to worry. We need to be focused on the solution in hand, and that is prevention. We should not get distracted. I see, sadly, there are numerous distractions now coming up, both within COVID and outside of it. In COVID, when we talk of plasma therapy or earlier HCQ, to my mind, these being unproven are distractions. I won't be surprised if plasma therapy doesn't pan out in the end. It's been used so extensively across the world that if there was a glimmer of hope in it, we would have seen it by now. The FDA prematurely made an announcement about its efficacy, and the person who made the announcement had to resign. We are then distracted by things outside of COVID, celebrity tragedies. People seem to be obsessed about that. I think we need to stay focused, Gargi, and we can deal with this.
All right, very interesting there. And of course, plasma therapy, what we've heard from a lot of doctors is the timing it has to be correct. And of course, it still remains an experimental therapy. But Sameer Gupta, the other big issue is that now coronavirus is spreading to our rural areas, and, where the health facilities may not be as good. And as Dr. Parekh pointed out, the numbers that we have are just those that have tested, the people who have tested. There's so many who don't get tested. In fact, our reporters are talking about how in rural areas that many people don't want to come forward and get tested at all, that there is some sort of fear, there's still some sort of stigma attached to coronavirus.
I think, Gargi, this is a very important point that, when we saw the initial part of the pandemic in India, it was primarily people who had international travel who were coming in, and it got infected and was spreading the disease, and that was primarily close to the metros. And we kind of anticipated, right? We knew that as people travel, as people go from point A to point B, the numbers are going to increase. In fact, they will take the virus with them, and the tier 2, tier 3 cities will also see a rise. And unfortunately, with COVID, what has happened is it has become a stigma. And we've seen multiple reports of violence across the country. We saw some from Madhya Pradesh, some from Rajasthan, all over the country, where healthcare workers are trying to go, are trying to go test, and then they're facing violence because of the stigma associated with it. And even, I'll give you a small example. In my RWA group that I'm a part of, I live in Delhi. I'm a part of a RWA WhatsApp group, and over there, there is constantly feeds coming in. Oh, this house में COVID पकड़ा गया, and it's like, you think for a second, you're like, this is an illness, this is a viral illness, so why are we stigmatizing it? And and then the government comes, they put a board outside your house. It was there outside my house also, and then the normal person who's coming on the street, he crosses on the other side when he has to cross. So there is definitely a stigma, and we have to come forward as a society to try and remove the stigma, because this is a big problem. And I would like to point out one more thing. We all talk about 80,000 cases. With the guest before me, with Raghav, you were talking about the number of cases and the hospitalizations. But the way I look at it is a little bit different. We know across the world that approximately 20% of the people will require hospitalization. Now, this is the data from the initial part of the pandemic, and that number, because of home quarantine and better facilities at home, may have come down to about 17%. Then out of this, about 5% will require ICU and 2 or 3% are then going to die. We know the statistic from data from China, from Italy, from America, from all over the world. So if you're talking about, on an average, 20% of the people require hospitalization. So don't look at 2,500 patients coming in. Look at the requirement of 400 additional beds. So when we have 80,000 patients, 80,000 new cases in the country, let's not say 80,000 cases. Let's look at it a little bit differently and say, 20% of them will require hospitalization. So let's look at about, what is 20% of this thing is about 15,000 beds, for example. So 15,000 beds is what we need. With aggressive home monitoring, with home testing, that number may come down to 12,000. So now, today, with 80,000 cases, India needs 10 to 15,000 new beds. So that is how you have to think about it.
All right, and that's how authorities have to manage it. Dr. Parekh, again, coming back to the fact that, we're in September and this is another phase of the unlock in which a lot of the metro services, bus services are beginning. So in a sense, the public also getting this message of government relaxing, and I asked this to Raghav Chadha, and not realizing that now the onus is on you. It's for you to take responsibility for your own health. So they shouldn't, and we have to get this message across that they shouldn't treat the fact that restrictions are lifting, which means that, you can just move around freely. You still have to be very, very careful.
Oh, absolutely, Gargi. So it's a twin message which needs to emanate from the media and all other possible sources. One was the destigmatization that was just spoken about. And on the other hand, is to be even more careful now than we were during the lockdown. So that needs to get through very, very clearly that, yes, the onus is on ourselves, and one should not be lulled into a false sense of security just because the lockdown is being lifted. It is being lifted for economic reasons. There are no compelling medical reasons to lift the lockdown. This is the practicality of looking at a different aspect of the illness, not the human suffering because of the illness, but because of the economics of it all. And you're absolutely right. We indeed need to be far more careful now than we have been in the past.
Absolutely.
And also, if I may add,
yes.
Just as a word of caution, that we're still dealing with the first wave of the pandemic. The influenza pandemic, which occurred 100 years ago, had 3 waves separated by a few months. And the second and the third waves were far more devastating than the first. So we are coping with the first wave now. The worst of the first is not over, but the second has not begun. Let's hope it doesn't happen. It is happening in Europe. It is happening in other parts of the world. It will probably happen over here. We need to brace ourselves for the next wave and deal effectively with the current one.
Right, Dr. Parekh, a ray of sunshine there. But yes, very important to tell people about this, that, this is just the first wave and just to take it as seriously. A lot of people, questioning why is it that we were cowering in our homes when there were just 500, 1,000 cases, and now with lakhs and lakhs of cases, we're all moving around. So that is the point, that you have to take responsibility for your own health and act like coronavirus is all around you. Thank you so much, doctors, for joining us on the show.